Welcome to the IPATS video demonstrating the setup for the Respireo mask for CPAP for all ages and weights. To set this up, you will need the large coaxial Hamilton circuit as per adult ventilation. You will also need the Armstrong Hamilton Mini Pharma HME, and again this is regardless of the size or weight of the infant or child. You will also need to select the correct non-vented mask for the child. This mask comes in extra small, 3 to 6 kilos, small, over 6 to 12 kilos, and child size, which was up to 20 kilos or 6 to 7 years of age. When you open your box, you will find a nasal mask, the head strap, and the blue coloured vent tubing connector. To set this up, you need to insert the blue connector into the nasal mask before applying it to the patient. This takes considerable force. You will hear a definitive click when it is in position, and because of the ball and socket nature of it, it will rotate freely around the nasal mask. We also generally recommend setting up the head gear in advance of commencement of CPAP. Please set the vent as you normally would from a tubing perspective for adult ventilation. Make sure you're in adult PED mode regardless of the weight and age of the child, and select the required weight. It's important to make sure that all pre-op checks are done, including the flow sensor check. And finally, go into modes, select NIV. For transfer, we typically use CPAP only. To deliver CPAP in this mode, you simply have to remove pressure support, turn it down to 0, and then select the desired CPAP. For tolerance purposes, we often recommend starting at a lower CPAP, 3 to 4 centimeters of water, and then increasing to your final desired PEEP once the child is settled with the mask. Set the FiO2 as required, and then you're ready to commence CPAP. To connect your tubing, insert your HME onto the coaxial circuit, and then simply insert the CPAP vent tubing onto that. Ask an assistant to hold the mask over the baby's nose and start the flow of oxygen via the ventilator as you then secure the strapping. These straps have quite long extensions with significant area for Velcro attachment that allow for quite a large variation in head size. Due to the soft nature of the textiles used, we have not found that there is a need to use gauze or any other duoderm or skin protectant like materials between the interface and the child. It is also worth considering the use of a sedative bolus such as chloral hydrate, clonidine or dexmedetomidine on instigation of CPAP for tolerance. Once it's attached and you're happy, the 360-degree ball and socket can be used to adjust and set the tubing down wherever is most comfortable for the child. As always, it is then important to check your ventilator and ensure that you have sufficient ventilation. To insert a nebulizer, simply insert the nebulizer between the HME and the CPAP tubing, connect to the Hamilton and deliver the drug.